Oral disease affects 3.7 billion people globally, making it the most widespread, preventable, non-communicable disease in the world.
Well, this isn't exactly a niche issue. It's a global health crisis hiding in plain sight, often treated as downstream, even though it's one of the earliest indicators of tobacco harm.
As I saw many times, a lot of my patients with these kinds of problems, and sometimes they said, "Look, I would like very much to stop smoking, but I cannot." So, and we have several therapies in our dental activity, in our dental office activity, that needs to stop smoking because the vascular dynamics, it's changed when the person is smoking. So sometimes we have to help the patients, and how can we do this if we don't have another tool? You know, usually when something innovative appears because it's a need. It's a need, so we don't find an alternative if we don't need it. So that's why I think the tobacco harm reduction is something that appears just because we need it. Like, let's say, a very basic example, the powder milk for the breastfeeding mother who cannot give milk to her baby.
Smoking doesn't just cause oral disease, it undermines treatment, it reduces blood flow, delays wound healing, and increases the risk of infection.
And it's not just about high risk, it's about poorer outcomes even after care begins. In this clip from the 2024 Oral Health Report launch, Professor Dr. Amalia, an Indonesian periodontist with a PhD from the University of Amsterdam and a researcher focusing on oral health, nutrition, vitamin C, and tobacco harm reduction, discusses what are the detrimental effects of conventional cigarette smoking on oral health. Let's listen to the experts.
The detrimental effects of conventional cigarette smoking on oral health are already well known, from benign to life-threatening diseases such as discolorization of teeth and dental restoration, bad breath, taste and smell disorders, impaired wound healing, periodontal disease, short-term and long-term implant success, oral mucosal lesions such as smoker's melanosis and smoker's palate, and potentially malignant lesions and oral cancer. Smoking is still a problem in Indonesia with a high number of consumers. Approximately 57 million smokers in Indonesia, comprises of 63% of men and 5% of women reported being smokers, a total of 37.6% of the whole population. Recently, alternative tobacco products are gaining popularity all around the world, including in Indonesia, such as heated tobacco products, vape, and snus, and it is claimed as less harmful or reduced risk products. But who knows? Is the evidence convincing? Studies carried out in dentistry evaluating the smokers who switched to alternative tobacco products or combustion-free nicotine delivery systems revealed that they demonstrated a reduction in the prevalence of micronucleated cells in buccal swabs, indicating that switching to alternative products may lower the prevalence of oral cancer. Smokers who switched to alternative products had no discolorization of teeth compared to those who continue to smoke, and the gum of smokers who switch show improved gum response to bacterial plaque challenge compared to those who continue to smoke. In addition, smokers who switch to alternative products tend to have lower plaque accumulation than smokers who continue to smoke. Unfortunately, there are still significant misconceptions about nicotine and tobacco harm reduction among both physicians and the public in Indonesia. As a researcher and educator, I recommend that the stakeholder or the authority or the government apply evidence-based policy. These alternative products may benefit us in decreasing the prevalence of oral diseases related to smoking, as well as helping smokers who are unwilling to quit or are not able to stop.
But Bryan, not all nicotine use is equal.
Well, exactly. This is where the risk continuum comes in. While the report distinguishes combustion-driven harm from nicotine itself, oral nicotine products like oral nicotine pouches expose users to over 95% less harm compared to cigarettes.
Okay, so this isn't a claim of zero risk, it's a comparative risk assessment.
Yes, exactly. You can't, we're not saying that nicotine or any nicotine use is safe, but you move down a continuum of risk. The report reframes nicotine through a public health lens, separating dependence from disease. And Sweden is actually a great example of this.
Why Sweden?
Well, Sweden's smoking rate is now at 5.3%, with significantly lower oral cancer rates. That's due to widespread use of non-combustible alternatives, including oral nicotine pouches. And this is what populational level harm reduction looks like when policy follows evidence.
Okay, so let's bring this into the real world, because Sweden's success doesn't reflect the lived reality of most low middle income countries.
Exactly. Users in LMICs already face multiple barriers, such as affordability, awareness, and access to care. The oral disease burden is highest there. Similar challenges are found and compounded when it comes to effective cessation programs, knowledge of harm, and meaningful access to alternatives. And now, while other THR products might not be able to cross the accessibility and affordability barrier, oral nicotine pouches mimic the experience of many smokeless alternatives, while also being potentially low cost due to their shelf stability and minimal need for infrastructure. In addition to the lower harm, oral nicotine pouches are socially hygienic and considerate, eliminating the spitting that often accompanies traditional smokeless oral products.
So what you're saying is equity isn't about raising barriers, it's about widening safer options. So what's the plan forward?
This report calls for 4 things: integrating tobacco harm reduction into oral health strategy, training dental professionals, risk-based regulation, and ongoing research and surveillance.
So for 3.7 billion people suffering from oral health diseases, the 1.27 billion people who smoke worldwide, and particularly the millions in low middle income countries using toxic oral tobacco products, oral nicotine pouches offer something unprecedented, a pathway to better health that acknowledges the real world barriers to cessation while delivering tangible harm reduction. Oral health policy can no longer ignore harm reduction. The evidence has simply moved on.
The full Cigarettes to Smile report is available to download,
with additional resources available at thr.net.